And we are live. It's Dr. J in the house with Evan Brand. Evan, my friend, how we doing today?
Hey, doing really well. So today's conversation is about the tongue. I always
Mm.
end up with photos. I know you do too. We have
hmm
inboxes full of parasites and weird things in the stool and tongues and skin. I mean, we've got
Totally.
a plethora of
Poop as
strange
well.
photos. Yes, and so I had some photos coming this morning
Hey, by the
from.
way, don't you
Yeah,
love the
tell me.
pictures like from like a random number and you're like, hey, I saw this in my poop today. What do you think?
I
You ever get those
know.
a lot?
Luckily, no, they don't have my phone number, but the email inbox has plenty. And this lady, so she sent in a message today, and she's got a 5-year-old boy, and he's got these weird red little splotchy circles kind of towards the tip of the tongue. And she's like, "Does this
hmm
mean parasites?" And my answer back to her was, "No, I can't confirm parasites just from the tongue alone." But it sparked this conversation because you and I talk about and look at tongues all the time, and you can get a lot of good data from the tongue. So the tongue is mostly made of muscles, but the problem is it's part of your oral microbiome. It has ups and downs depending on what's going on in your gut. And so we'll
hmm
see. Let's start with the first easy one. That's a white coated tongue. We'll see that very, very often. And I'll often ask people, especially if we're doing video calls, hey, let me see your tongue and I'll take a look. And even before we have lab testing, we'll see oral thrush. And so that could be just at the back. And some people say, oh, well, I'm tongue scraping every day to get that off. It's like, yeah, but I don't know. I mean, that's almost like, I don't want to say picking your scab. You're better at analogies than me, but it's like tongue scraping is not actually curing the yeast. Maybe you're scraping it off and your tongue looks pinker after you do that. But if there's white coming back, there's an internal issue we need to fix further south in the gut. We can't just
Totally.
scrape this stuff away.
And you got the image here. So you can see this white, creamy kind of layer patches. Yeah, you could scrape this. You could do some hydrogen peroxide, 3%, or some colloidal silver flushing or gargling for sure. But like Evan you just mentioned, it's probably an extension of something deeper in the gut as well. So you definitely want to look at the microbial imbalances further down the digestive chain, if you will.
And what went wrong? Well, it could have been oral antibiotics. Maybe you had a dental infection or something. The dentist prescribed
Totally.
something. You had a rebound infection like that. Maybe you were hospitalized. Maybe you have a weak immune system. Maybe you have an autoimmune condition. Maybe you have mold toxicity. Maybe you have some level of dysbiosis that's now allowed Candida to join the party. We often find Candida is not in isolation, but rather in combination with other infections. So if we find Candida just on the tongue, that's pretty rare. You're often going to see it test positive on both the organic acids test, and if it's bad enough, we'll see it on the stool test as well.
100%. No, I agree. So when we see gut stuff like this, like the Candida, we want to do some testing, right? Sometimes the stool testing may not be adequate enough to pick up Candida. So we'll look at clinical signs like the tongue. We may look at the fingernails or the toenails for that yellowing, kind of thickened, discolored nail. You may look at seborrheic dermatitis or that chronic dandruff on the hair, on the scalp. We may look at that tinea versicolor, which is that kind of almost like lighter white spotting on the skin. That can be fungal in origin. Anything that's chronic candida, chronic yeast infections for females, that higher pH in the vaginal tract, 5 or above, could be a sign of chronic candida in the vaginal area as well. So these are all good signs that are, let's say athlete's foot as well, that itching between the toes. These are all good signs there could be a chronic yeast issue internally that we have to look at. And so the tongue is a good first step.
Yeah, well said. So, I mean, if we're not stripping these people down and looking at every nook and cranny, the tongue is a great place for us to quickly diagnose and say, hey, yep, there's probably a yeast problem, but let's confirm with the functional
Mm-hmm.
labs. And
Correct.
the toenails, too. God, I remember as a kid, my grandpa was doing that. What was it called? Lamisil. It was so popular. They were doing
Yep.
so many commercials. And I mean, that thing was in like every man above 50s, uh, his dresser. And they talk about it for itching, burning, cracking, redness, and blistering. It kills the fungus that causes foot odor. So the pharmaceutical name is terbinafine. Terbinafine. So the brand name was Lamisil, but it's terbinafine, and that is an antifungal. And so they would do that to try to treat
Mm-hmm.
these,
Mm-hmm.
but yet then the men go drink beer and they eat sugar and they've got this internal yeast and they're just hitting the toenail topically like it's going to do some magic remedy.
Well, plus that medication is very hard in the liver. A lot of good doctors, if they're giving it, they're going to monitor their ALT, their AST, maybe their GGT liver enzyme markers to make sure it's not going high because it can be super hard on the liver.
Wow.
So, I mean, if you're going to take that, I mean, you're much better off taking some milk thistle and some NAC with it. But ideally, do something more topical that's got a tea tree, an oil of oregano, or an undesolenic acid, or
Yep.
even the carousel is nice because it has a acid in there that's very helpful at breaking down that keratin debris in yeast. So, really good to have some other options besides just an internal medication. The topical, better. Like let's say it's a fluconazole or a ketoconazole or a nystatin topical, better, but it still can get in the bloodstream and still be harder on the liver too.
Yeah. And so why are we talking about toenails now? Well, because if you have yeast on your tongue, that could also be showing up elsewhere. You could have a vaginal yeast infection, toenail issues as well. And then some of the symptoms associated with this could be anything from brain fog to fatigue, sugar cravings, even dizziness, tinnitus, itchy ears. So that's ears ringing. That's tinnitus. That could be happening due to this internal acetaldehyde production happening from the yeast overgrowth. Now, let me
Mm-hmm.
stack one thing on top of that too, which is a what some people are diagnosed with what's called burning tongue syndrome or burning mouth
Mm-hmm. Mm-hmm.
syndrome. I had a woman that had this. We think it might have been related to the virus. We're not 100% sure, but it took us literally probably 6 months to repair it. And one of the tools I think helped her was lion's mane mushroom. And I think the mechanism was that there was some nerve damage happening just based on the way she was describing it. I don't know. You know how it is. Sometimes things just speak to you and you're
Yep.
just like, okay, I'm called to try this. And so we tried it. And sure enough, it went away. And so
Wow.
there's some nerve issues that can happen with the tongue as well. I would argue, even when I had Lyme, Babesia, and Bartonella, that will go into the next one, which is a scalloped tongue. So scalloping, I might have put one in that chat, but if I didn't, oh yeah, pull up that paper. There's that paper there on. This is a Japanese study, and it's titled "Scalloped Tongue Associated with Nocturnal Intermittent Hypoxia."
Yes.
And long story short, this paper discusses that people that have a scalloped tongue, which is where the edges towards the front are almost like little waves. You'll see these waves. People just Google it for yourself. Look up scalloped tongue. There's some nasty photos out there. But this paper showed the conclusion is scalloped tongue associated with higher prevalence of moderate to severe sleep apnea. And this is more evident in overweight individuals.
And so you can see some of the scalp tongues, just the little waves on the side. And usually what's happening is this inflammation of the tongue. The tongue's also going a little bit wide. I think some of it is it's pressing into the teeth as well, right? To get a lot of the wave stuff. And so it's probably that tongue's going a little bit wider, probably due to inflammation.
Yeah, and so if any of our dentist friends are watching, they're going to say, "Oh, this is a malfunctional issue. You need to like expand the palate. This means
Hmm.
your palate is too small because of Dr. Weston A. Price's work, and everybody's skulls are shrinking, and the tongue doesn't fit inside the
Hmm.
mouth anymore." Yeah, I mean, there's some of that, but I saw my scallop tongue go away after treating the infections that I had, as well as just
Inflammation, right?
yeah. I mean, I think I was just chronically inflamed. I didn't really look puffy or swollen, but my tongue certainly was, and I tell you, it's kind of creepy, but some days it feels like it was affecting my breathing. I mean, the tongue was so thick and inflamed and scalloped. I was like, I need to stick my tongue out to breathe here. This is crazy. And it's way better
100%.
now. So I'm much better now. I have no scalloping. If you want to come do a tongue inspection, you can. But my scalloping is gone, and it feels like I can talk better too. I mean, we got that fat inflamed tongue. It's kind of hard to speak.
Yeah, and so it's also associated here with this nocturnal intermittent hypoxia, right? So you're having low hypoxia, or sorry, lower oxygen levels. So that's impacting breathing. And a lot of times with the tongue being inflamed, it's going to impact that airway. And that's why there's a lot of mouthpieces that are out there that jut the lower jaw a little bit more forward, and that opens up the airway better. Or some will even do a CPAP that does a forced pressure in there that opens up the airway. But in my clinical opinion, it's usually the inflammation of those tissues that are causing constriction in and around that area. So if you get the inflammation better, that's going to help. And from a myofascial or myofascial standpoint, yeah, nutritional deficiencies will narrow a palate over time. And then a lot of dentists, they just want to come in and pull out teeth and do all this. The better way to do it is to widen that palate with some kind of a palate spreader or some kind of a myofascial device. My wife has one right now too, where it actually widens the jaw. She has a little key and she cranks it, and she's widened her jaw like this much. But as a kid, she couldn't do braces because they wanted to break her jaw and pull out a couple of teeth, and that just sounded crazy. But now there's some better devices. But in general, getting the inflammation down in those areas is the first thing. And so we start with food. We start with microbes in the gut, whether it's Candida, bacterial overgrowth, H. pylori. We start with mold. We start with just inflammatory foods coming in, whether it's rebound overgrowth from food that's sprayed with lots of Roundup or glyphosate or lots of pesticides. All these things are going to negatively impact our microbiome and thus could lead to our tongue having scalloped sides or having the fungal white coatedness on there, or even some of the cracks on the tongue, or some of the chelosis on the side of the mouth, which a lot of times can be a sign of B vitamin issues. And so it could be your diet's full of processed food. It also could be your gut's jacked up and you're not absorbing a lot of your nutrients well either.
Yeah, and if there's acupuncturists listening out there, we know that Chinese medicine has looked and studied the tongue for a long time, and so there's some interesting like Chinese medicine articles that we looked at that talked about yin and yang deficiencies and what's happening there. So I have seen some of those Chinese herb blends help people, but I don't mess with them too much. It's hard to find the quality, and they're not doing the same purity and stuff that we're doing on these U.S. made products. So
Well, a lot of those products too, they're going to have an antimicrobial aspect to it and then an anti-inflammatory aspect. So
yeah.
they're still trying to get the microbes down. They're still trying to work on the inflammation in a more natural type of way too.
Yeah, you know what I think's helped too is probably doing some of the oral mouth rinses that have clove. You and I've messed around
Hmm.
with some different toothpaste and some mouthwash products over the
Yeah.
years, and some of the ones that have clove in there, that's going to be helpful to help regulate the oral microbiome.
Yep.
There's also we've talked about this briefly, but the salivarius strain, there's some oral probiotics
Hmm.
you can do, like these little lozenges that dissolve in there. There's some oral like throat sprays that have herbal antimicrobials in them as well. So we can hit it like at the source, but we're obviously wanting to look into the gut as well because oftentimes by fixing the gut, we fix the tongue.
Yeah, there's some great toothpaste out there. I mean, I like one by Designs called Parabiotic Plus. That's a good one. It has silver in there, which is good for regulating the microbes. It has CoQ10, which is great for the gum health. It has the salivarius and some other probiotic species. It has some other essential oils in there like peppermint and such that can be really good at regulating the oral microbiome. Revitin's a good one too, but like we mentioned, we also want to do some, something topical like some silver flushing or even oil pulling, where you take some MCT oil or coconut, maybe a little bit of clove or cinnamon, and just flush it around your mouth for 10 minutes, spit it out. Or even just some simple 3% hydrogen peroxide. You can go half and half, half water, half 3%, or just do it straight and gargle that for a minute. That's wonderful because it'll bubble. You'll get an oxidation reaction right in your mouth. You'll feel the bubbling, spit it out. That's great too.
Yeah, even when if I'm down at the beach, I'll just gargle salt water. That seems to feel good, especially if my throat's all weird. I'm just like, ah, and then I'm
Well,
like,
we
oh,
were
I'm
at
cured.
Yeah, we were out seeing Brendan at Santa Cruz Medicinals, and we were I think you were in the hotel room and you had a little throat issue from the
Yeah.
flight, and you were gargling sea salt like crazy. I got this little lingering bit of mucus in my mouth. I'm trying to knock it with NaC, and I'm gargling, but I just like you do, I'll gargle with some really high saline content water, and that will kind of break up some of the mucus a lot too.
Yeah, I mean, you can have biofilm and all sorts of issues
Oh,
here.
huge.
This is a big deal when it comes to endoscopies too. So this sounds like a little bit of a tangent. We'll get back to the tongue in a second, but
Yep.
I found that hospital acquired infections are like the third leading cause of death in America. So let me say that again: hospital acquired infections, top leading cause of death. Meaning
Huge.
you go in, you're trying to get treated for one thing, you end up with some other infection, and the problem is when they're doing these endoscopies to look at your upper GI because of antibiotic resistance and just maybe not properly sanitizing or cleaning, a lot of these scopes are dirty and you're actually picking up Clostridia or some other
Yep.
pathogen from the endoscopy. So you're getting a routine procedure, and now all of a sudden you've got this thing in you that some other guy had in his gut, and now you've got this bug. So that's a problem too.
100%. I totally agree. So it's good to be on top of that for sure. So if we get back and look at some of the other tongue stuff, a lot of times we will see bright redness or we'll see little dots on the tongue. That can sometimes be B vitamin issue. Sometimes some of the red dots could also be little mini cherry hemangiomas. We may think estrogen metabolism issue, but B vitamins. Also around the mouth, we'll see chelosis. I'm going to pull this one up.
How about the cold sores in the mouth there? Isn't there
Yeah.
another name for those? I feel like it's slipping me.
Yeah, I
Not a
mean,
cold
there's
sore. What do you call it when
yeah,
they're right there in the gums? You see them under the tongue too. I've seen people
it's
saying
called
that.
a canker sore essentially.
Yeah, the canker. That's right. That's right.
Yeah, which is an abbreviation for something else. Canker sore name it's like yeah, a
That's
aphthous
yeah.
ulcer.
Yep.
Yeah, but it's cheilitis, angular cheilitis, and I'll pull up an image here so you guys can
Yeah, I've
see.
seen the cheilitis. I've seen photos of that.
So
And
you can see
so the interesting
here.
thing is about these, the canker sores. I mean, we're going to see that from food sensitivities, especially gluten.
So big ones here. You see how it gets really red in the corners here,
Ugh,
red here in the corners, a little bit red there.
nasty.
Yeah, red here in the corners, right there. That's usually a sign of B vitamin issues. And also canker sores, right? Canker sores, for instance, were a massive canker sores in gluten. For me, I had the worst canker sores as a kid. So right here, that's your aphthous ulcer right there,
Oh,
right?
here's a
What
fun here's a fun
how
fact
I
for
would
people.
how I would treat that, by the way, is I would do a little bit of baking soda and hydrogen peroxide, and I would just rinse that thing. I'd rinse, gargle with it, let it hit it. But this is almost always a gluten connection with this.
Yes. So here's a fun fact for people. A lot of people with the cheilitis, vegans. Just Google it. Vegan cheilitis. You'll read on the
Oh,
forums. People have it. And why? Well, you have nutritional deficiencies.
mm,
You're not eating the meat. You're not getting all of your B's there. You're missing out on iron. Just Google it. You'll see it on the
yeah,
forums. You need some animal meats.
yeah. Vegan sources, yeah. A major source of iron is red meat. People who try a vegan diet may not eat enough of it.
Look on
Yep.
Reddit, cheilitis. Here's a lady right here. I got cheilitis right after going vegan. There
Yeah,
we
right here.
go.
Just because you may not get enough of the B vitamins in a lot of these animals, it just depends, right? If you're going plant based and let's say you're doing lots of like green vegetables and you're really on top of your veggies and maybe you're doing some good high quality fruits and you're getting some good fats, maybe. But the problem is a lot of vegans are going to be eating a lot more processed grains and processed flours, right? So in meat, people forget animal products, especially grass fed meat, incredibly nutrient dense in B vitamins, amazingly nutrient dense.
Yep.
Yeah, I see it right here. Went vegan 1 year ago. My lips started peeling around that time. I knew that was not normal after the first month. Why did this happen? How do I fix it? Yeah, no, that makes sense.
One thing I'm reading here, research says 90% of the cheilitis is caused to poor diet, vitamin deficiencies. Talks about B2. Where are you getting
Mm-hmm.
B2? Eggs, milk, meat.
Mm-hmm.
B12, folic acid, zinc, meat. Yep.
100%.
But what are they going to
100%.
do? They're going to go buy their, well, I guess you can't do beeswax. That's not vegan. Are you going to go do your soy oil lip balm and you're going to just coat your lips in lip balm?
Yeah, or a lot of times they'll do nutritional yeast, which is pretty high in B vitamins too. A lot of times they'll do that. But like, I mean, for instance, right here, I mean, I go to my food data, like the number one source of B vitamins, riboflavin, is beef.
Oh, give me that skirt steak. Get that
Right
tofu
there,
out of
right
here.
there. Now they'll say tofu. The problem is they're not looking at absorption because there's a lot of mineral blockers and a lot of proteolytic enzyme chymotrypsin blockers. So just because it's there doesn't mean you absorb it.
That's right.
Plus, you get all the phytoestrogens and crap in that too. Yeah, so milk, not great, right? Because a lot of the casein. Plus, you want the full fat. Salmon, look at that. That's a great source. Mushrooms, great source. Pork chop, great source. Some greens, some nuts, some almonds, avocados. I mean, so you can see eggs. If you're looking at the top 6 to 7 foods are going to be something in a paleo person's diet.
That's
Now you
right.
can, if you did some avocados and some nuts and seeds and some greens, and maybe a little bit of nutritional yeast, you may be able to get away with it. But the problem is most don't do it right.
Yep. Okay. So we talked about the coated tongue, the scalloped tongue, the cracking. I mean, I'm going to blame nutrient deficiencies on that. We just see
Yeah.
the tongue health improve with all the protocols. So it's hard to go, hey, this one variable was the fix for the tongue. No, I mean, when you and I are designing these protocols, they're comprehensive. There's liver support, adrenal support, lymphatic
Mm-hmm.
support,
Yep.
anti-inflammatories, antimicrobials,
Totally
antifungals. So it's hard to just go that one lever did this.
correct. Correct. Exactly. Again, the tongue, it's one indicator. So if I see fungus stuff, if I see spots, if I see cracking, if I see scallops, immediately say, okay, let's look deeper within. Let's look at how the gut's doing because that's where everything gets absorbed. Let's make sure the diet has the nutrients in it. Do we have canker sores? Let's make sure we get the gluten out. That's a sign of gluten sensitivity. Cut the gluten out. Let's make sure we don't have any angular cheilitis. right? It's B vitamin issues. Let's look at other types of spots on there or scalloping. And then, hey, do we have breathing issues, right? Do we have sleep apnea at night? And maybe we want to see that the scalloping improve because maybe that tongue is narrowing out a little bit because there's less inflammation impacted the mouth. So
Yep.
all these are really good things. Now, in the meantime, if there's breathing issues, I'd much rather have someone do like a Snorlax mouth guard, something to jut the jaw a little bit more forward and open up the airway, but that may still not be the root cause. Some of the root cause may be a wider palate. Some may be we got to get the inflammation out. Also, too, if we have inflammation in our sinus cavity because we have chronic fungus or let's say Marcons or methicillin resistant bacteria, we may have to flush out a lot of the crap in our sinuses because it is pretty close to our oral cavity and could be easily creating inflammation in this general area.
Yeah, well
Thoughts on
said.
that?
Yeah, well said. I interviewed a dentist, cool guy. I think you'd really like him. I think he's out in Washington, and we were talking about mouth breathing and
Hmm.
sleep apnea and facial development in children. And he was telling me that just by mouth breathing, you're actually creating more inflammation all up in the sinus cavity and the turbinates. You're actually inflaming the turbinates by not breathing through them. And so I noticed that after doing, I'd say maybe 3 to 4 weeks of mouth taping, I could breathe way better through my sinuses, like everything had cleared out. And I didn't have quote sinus drip or it didn't feel congested. It's one of those things you don't know how bad it is till it clears up. I'm like, wow, I can breathe better. So yeah, I think you're onto something there. And one thing I'll mention too, there is such thing as tongue cancer. We are not oncologists. So if it's something freaky and you tried everything, like you might need to eventually get it checked out. I have seen tongue cancers exist. I met one guy a long time ago that had his tongue cut off. He had tongue cancer. So that was weird. But also anemia. So pale tongue. We forgot to talk about the pale tongue. That's going to be common in your vegetarians, vegans as well. Just that kind of very, very, I mean, you know what pale meat looks like. I mean, it looks more like light pink. It doesn't have that nice, healthy pink. It's that pale
Hmm.
pink. That could be an anemia issue.
Plus, also there's parasympathetic nerve fibers in the nose, right? So we have the ophthalmic, the oculomotor, and we're going to have some cranial nerves up in the nose as well. Especially, I think it's cranial nerve number 7. They're extensions of the fifth, the facial nerve, essentially. So we have the facial nerve. The seventh cranial nerve is responsible for nasal gland via the parasympathetics. And so
Mm.
what this means is if we breathe through the nose and stimulate those nasal fibers and those nasal nerves, it's going to impact with that facial nerve, and that's going to hit that parasympathetic region. And so parasympathetics, that's the rest, that's the digest, that's relaxation. So if you have a lot of adrenal stress, that sympathetic, breathe through the mouth. That's like you're panting. You never really get a deep breath. Do a deep nasal breath. You really get that good parasympathetic going. That's going to really help the adrenals and prevent you from triggering that fight or flight all day long chronically. And that's where I think mouth taping really helps because you're forcing that parasympathetic to the nose. But just when you're sitting at your desk, just really focus on keeping your mouth closed and just
Yep.
doing everything to the nose. Much
Yeah, I
better.
mean, how many times have you seen somebody, having a panic attack, nose breathing?
Mhm.
I
Mhm.
haven't seen anybody. It's and you're freaking out. So, you know, you gotta shut that mouth, and you gotta watch your kids too. I mean, there's some mouthpieces that we've done for our kids that are silicone based where you can help them because if kids are mouth breathing, that's furthering the sinus issues, and then you're adding dairy to the mix, which is further inflaming the sinuses. So kids, it's really important for their facial development, their facial structure. If you're gonna go spend 10, 20K on braces, if you get that mouth shut, and even this dentist I interviewed, he was a big fan, a big proponent of taping your kid's mouth shut. He said, just get them used to it. Do it during the daytime, just a little piece of tape, get them used to it. And then after they're feeling comfortable, tape it at night. Like he was all for it.
Yeah, absolutely. And then people hyperventilate too. That stress response actually you blows off the CO2, right, which causes alkalosis in the blood. And that's why remember back in maybe the movies in the 80s or 90s, people would start hyperventilating, they take a bag and they
Yeah.
breathe into the bag, right? They're doing that to recycle the CO2 so you get more CO2 to bring the acidity back because you start to actually go more hyperventilating leads to alkalosis. So you become more alkaline. So you breathe, so you become low in CO2. And so essentially you breathe in the bag to increase the CO2, which brings the acidity up, which brings you back to balance.
Yeah, I remember Mercola was real big into that a few years ago in the Buteyko breathing method, but then he kind of turned his mind on it. I think he's like against it now. Anyway, I can't keep up, but long story short, get your nose fixed, antifungals, oral antifungals. Let's get some functional medicine labs on you and we can help you. So if you need
Hmm.
help, you got to get the urine, we got to get the stool. Those are going to be the top two places we can start. And
Yeah.
we love to help you guys. And we work all around the world with people. We've even had people, I had a guy in Kenya. We were able to get his lab testing done in Kenya. That was wild.
Wow. That's
So
cool.
so
Wow.
we can help people all over the UK. We have distributors there. We have Australian distributors. So wherever you are in the world, we are happy to help you guys. And if you need help, Dr. J is at justinhealth.com. You could reach out for a consult worldwide, get some labs done, get a protocol made. And then for me, it's Evan Brand, evanbrand.com. You can reach out. We're happy to help you guys and we'd love to help you. So take a look at your tongue, look at your kids, look at your spouse, see if they got something funky going on. It's a good clue, good place to start, fun conversation starter at a party.
Yeah, I appreciate it, Evan. So yeah, just recap. You can also do saline, some saline packs, and some good clean distilled or RO water. Add a couple drops of iodine in there. You can always rinse and gargle with that with your mouth. You can also flush your nose out. That's a good start. What we talked about, look deeper at the gut. The chronic gut issues can impact. Obviously, the microbiome can extend into the oral cavity, right? And then obviously the environment. If there's mold, if there's high humidity, if there's lots of mold particulate in your environment, that could also be impacting your sinus cavity and trickling down to your tongue as well. So don't guess, definitely assess. Again, evanbrand.com to reach out to Evan, and Dr. J, justinhealth.com for myself. Again, we see patients worldwide. So if you want more support, let us know and put your comments below. Love to know what you guys think about it and future topics that you guys want to hear more about. Evan, anything else, man?
No, I think we're good. So if y'all need help, reach out. We're here to help. Don't be silly and wait till you hit rock bottom. If something's off,